Hi, my name is Ashley Ruiz. I'm a PhD student at UWM, forensic nurse, and lead author of this comprehensive historical analysis that examines hegemonic masculinities and its impact on ethnic minority women's experiences of sexual assault. I believe this paper is significant as it represents an echo of the past, how the past impacts the present and will continue to dictate future health outcomes. For this reason, it's important for healthcare professionals, specifically nurses, to be able to not only recognize this history, but be able to take action through effectively implementing healthcare interventions and healthcare policies that challenge dominant ideologies. In this case, we're focusing on the dominant ideology of hegemonic masculinities and how it's been used to justify, minimize, and overlook experiences of sexual assault for those that are experiencing systematic oppression from sexism and racism. This is particularly relevant at a time in which we're experiencing a global pandemic and all types of violence against women have intensified due to healthcare policies, impartial and good intention towards flattening the curve. We're also at a time in which our nation is leading resistance and movements towards calling out and challenging power dynamics that lead to fatal health outcomes.
Bonjour, Kiniwea, Ogimakwe, Nindijnakas. Hello, my name is Jeneile, and I'm an enrolled member of Bad River Band Ojibwe, and I'm one of the authors of this article. This article, I feel, is very timely as we are experiencing a crisis of violence against women of color. Women of color are impacted disproportionately against violence such as sexual assault, intimate partner violence, and trafficking. So this article, we really analyzed and discussed the ways in which this violence is perpetuated, particularly in this country, where racism and sexism and hegemonic masculinities are embedded in our society, and they impact people at all levels, including healthcare providers, academic institutions, social service agencies, law enforcement. It really perpetuates violence, and it really causes oppression and prevents women from being able to access the services that they desperately need and deserve.
So the question I think we need to ask ourselves as professional nurses is, why are we okay with the violation of black and brown bodies, the bodies of black and brown women in the United States? And what is our role at this point, especially in the current dispensation, in addressing issues of injustice? And so we need to make clear to the communities that we serve and the communities that count on us for care that this is something that we are willing to address as not just academic nurses, but as nurses in practice, as nurses working in federal and state government, wherever it is that we're situated, that we're going to address the problem of violence in the lives of Black, Indigenous, and women of color. And so our article provides an opportunity, a foundation for us to address the history of sexual violence in the lives of specifically Native women and Black women. And so hopefully that foundation will enable us as nurses to develop interventions and policy that address these issues.
One of our co-authors, Katie Klein, is a second-year MA student instructor in Women's and Gender Studies at UWM. She shares the following. I saw feminist theory because I was desperate for a way to elucidate and eliminate the unacceptably common experience of gender-based violence. For me, the significance of this paper comes from the utility of applying feminist and anti-oppressive theory to nursing education. It is a privilege to write with nurses and allied health professionals for our nursing audience. Victim survivors cannot heal through theory alone. Theory is not only liberatory if we apply it towards liberatory aims. Understanding the historical and current systems of intersecting gender and racial oppression that impact victim survivors seeking care is vital to improving interventions. Identifying hegemonic masculinities as the root cause of sexual assault against racialized women is key to removing barriers to healing and ultimately ending violence. This paper is an example of feminist proxy that centers harm reduction through critical education to disrupt and transform harmful ideologies.